Welcome to Therapy Cafe, the Future of Mental Health Episode 10, Culturally Responsive Mental Health Care for Veterans and Active Duty Military, with our guest, Sheena Bice. Today we're going to discuss the topic of cultural competence for mental health providers working with military personnel and veterans. This episode is close to my heart because of the time I spent serving the military and veteran population as a therapist. Understanding the unique values, traditions, and experiences of military culture is crucial for effectively addressing the mental health needs of this community. Military life comes with distinct challenges, such as frequent relocations, deployments, and exposure to traumatic events. By acquiring cultural competence specific to the military, mental health professionals can better navigate these challenges, build rapport, and provide more effective care. At the end of the podcast, we'll provide information about how you can obtain continuing education for this course. Also, ensure you never miss an episode by hitting the subscribe button. Here's my conversation with Sheena.
Sheena, I am so excited to be here with you because I've spent more than half my career working in the military veteran space. And as a therapist, this is like absolutely one of my all-time favorite conversations. And it's just very exciting to have you on and, just your vast different experience, which is very unique for the space. Mm-hmm. So I'm going to start with just telling our audience a little bit about how lucky we are to have Sheena Bice with us here today. Sheena is a licensed mental health counselor and holds a master's degree from the New England College. She currently serves as the Chief Clinical Officer for Forge Health VFR. With a diverse background in community mental health, private practice, and corrections, Sheena focuses on delivering trauma-informed care to first responders, veterans, service members, and their families. As a U.S. Marine Corps veteran and military spouse, her journey as a trauma therapist began in 2012, encompassing roles in emergency services, crisis stabilization, and corrections. She entered the insurance field in 2016, gaining valuable insights into managed care organizations and specialty care programs. Since 2017, she found her true passion, which lies in supporting veterans, service members, and first responders, which is evident in her development of programs to reduce mental health stigma among first responders. Sheena actively contributes to several committees and boards dedicated to improving the lives of veterans and first responders, demonstrating her commitment to enhancing access to care and legislative initiatives for those who have served our country. So this is going to be great, and I'm so excited about it. So for starters, thank you so much for being with us. Welcome. Tell us like a little bit about yourself. Like what's your background? What brought you into this in the first place?
Oh, oh my goodness. That's a loaded question, right? What brought me into this? I don't know. We have enough time for that. But really, one of the things I recall very early on is telling my grandmother, at age 11, right? Grandma, I'm going to be a Marine, right? My grand's like, why didn't you do something like, any other little girl? Why can't you dance? Why can't you do this, that, and third? So it really started, very early on for me, both as wanting to serve my country, right? And as I moved through just kind of high school and my education, wanting to help, wanting to support people. So that's just the trajectory, right? I enlisted in the Marine Corps when I was 17 and, into college right thereafter. To become a therapist. I was like, this is just what I want to do. This is where I want to be. And through, Graham will tell that story to this day. She'd be like, but that's okay. We have the picture up. So as I went through, my very classic, mental health counseling education and started to experience crisis work and emergency services and all those things, that was really just a place of comfort for me. And I was lucky enough to have my personal connections and professional connections and just found my path and pushed my course until I locked into working with veterans and first responders. And as a therapist, when you kind of find your population, right, you kind of find your people, you're like, this is it. This is where I need to be, both surrounded by other therapists with this similar passion, as well as being able to work with, again, my population. These are my people, and I want my brothers and sisters to be healthy, that transition home and be successful and navigate life.
which is amazing. So help our listeners to understand. So you joined the Marine Corps. I'm assuming you went to Parris Island.
I did.
And then did you get like assigned a MOS? Like, did you start out as something like, yeah, she's shaking her head.
Yeah.
Yes.
Yeah, I'm shaking my head yes, because it's always interesting when people go, "You're a therapist, but you're a Marine."
Right,
And when you know
right.
when you know what you know about the Marine Corps, most people know is we don't have a medical component. The medical
Right.
component for the Marine Corps is the Navy. So if I wanted to be a therapist, a psychologist, a doctor, a nurse, or anything like that, the Navy probably would have been the route to take for that. But that wasn't the option. So I was, I went to Parris Island. Absolutely. I was this side of the Mississippi, and women at the time were only going to Parris Island in South Carolina.
That's how I knew, just so you know, I worked at MCRD San Diego. So I
Yes.
knew if you were a woman, by default, you went to Parris Island.
No matter what, right? Men, this side of the Mississippi go to Parris Island, that
Right.
side go, they become Hollywood Marines is what we tease about that. But over time, with the integration and the changes, we are seeing some differences there. But during my time, it was Parris Island. And my MOS, my job, my military occupational specialty was an electrician because, well, oddly enough, that's what I studied in high school. I went to a tech school. So I decided to pursue that while, then getting my education in mental health counseling.
So then you stayed in for a little while and then said, I'm going to go to school. I just want our listeners to understand that so many times passion and life experiences lead us here. And the decision at 11 was, I'm going to be a Marine. And when you got in, something drove you, called you into the mental health field. And then, again, these are not easy things. You gloss over it like it's just easy, but you got to get through college and you got to get through a master's program. So that is no easy feat while you're serving our country, while you are, either, doing your day job as electrician. I don't know if you had deployments, but moving and all of that. So this was not just I checked in the box of doing this. Is that fair?
It's fair. I mean, there's always some challenges, right, along the way. It's competing responsibilities and things like that. I was reserve. I was part of the reserve component. So I was able to go to school while I was serving in the Marine Corps. Along the way for me, I was expecting, I had a trajectory of I'm going to become an officer. I'm going to kind of be a lifer, maybe even transfer to the, transition to the Navy so I could be that psychologist in the military. But along the way, I was injured. So that shifted what I was going to be able to do and what I was could envision myself in the military. Right. So along the way, I was, separated and pursued my education and was like, I'm not done, though. I'm not done. I need to continue to support, again, my brothers and sisters, the military as a whole. This is where my passion lies. And then, yeah, you're right. Between the bachelor's degree and the master's program and the internship and all that stuff that all the therapists are very familiar with as well. We mentioned I married a Marine because, couldn't see myself with anybody else, right? He had a deployment along the way. We had young children in school. So I married a Marine. He deployed when we had very young children. I was in school working full time. So we had to make it work, right? One of the big things you'll see with this population, and as we chat about, is adaptability. You adapt to challenges along the way and you make it work. You make it happen.
So is your husband still a Marine?
So, well, once a Marine, always a Marine, right?
That's
so
fair.
he is no longer in. He served 14 years himself.
Wow.
2 deployments for him. Yeah, he was infantry, so I was utilities. He was infantry. Yes, we did meet in the military. That's just one of those things that happens, and we I think instill those values and those morals, is really how we came together and how we raise our children, all 3 of them, who are probably not enlisting.
All right. So background as a service member, a Marine, a military spouse, And then you went on and got your master's degree and had all of these different experiences. So my experience when I got to MCRD, I knew nothing about the military, nothing.
Mm-hmm.
And I started working with drill instructors. And that's what I spent a good portion of my time developing a proactive counseling program for drill instructors. If you can imagine, that's where you start with knowing nothing. And what I was surprised about was how little I knew about the military and the culture. And my learning curve was very, very, very steep, if you will. And, I obviously went a different route. I was a therapist before I got there, but then I started Psych Armor, a online education in the military veteran space, because I found that it was so hard to learn. So that was obviously before I started before I founded Psych Hub, but all that to say, it inspired it. So I kind of want to just sort of start with, when we say the word military, because I think people get confused between, we talked about Marines, you talked about Navy, we talk about military, we talk about, they're all very different, right? So what does that mean to you, and how can you help our listeners understand the differences?
Yeah, so they're so different, but so much the same, right? And that's really something to reconcile, right? As an individual, as a therapist, because when you see a Marine, we bring everything forward from our experience, right? It's ingrained in us, the brotherhood, the esprit de corps, and it's going to look different from a soldier. So just kind of like backing up a little bit is, what are the branches? What are the branches in the military? We hear about them. Some people are more familiar with one or the other, but really we got the Army, right? We have the Marine Corps. We have the Navy. We do actually have the Coast Guard as one of our branches here, even though they're not Department of Defense until wartime, right? During peacetime, they are Homeland Security, but they're still one of our branches. And then the newest one, which I'll tell you right now, I'm still learning about, is Space Force. That is a branch of the military that we are going to be learning about together. So those are the big ticket items, right? When we think of who is the military, what's out there, and what do I need to know as baseline? Army, Navy, Marine Corps, every time, Coast Guard, and Space Force.
So there's kind of this expression that people outside of the military call everyone a soldier.
Ooh, mm-hmm.
Right. So as for therapists, I think it's important, if they're going to see someone from that veteran space, that they sort of understand that. Do you have comments on that?
Yeah. Oh yeah, I have a ton. Never call a Marine a soldier. Never call a seaman a soldier, right? We have all of our CBs and all these different names. But yeah, language in the military is so important, period, full stop, right? So we need to be very intentional in learning about our clients when they come in. Being curious during the intake process of asking about their time in service. And then you start to understand, you get an idea of where and how and when they serve. So if somebody's coming in, in their Army, they're going to be referred to as a soldier. That's a proud thing for them. They've associated themselves with that and they've aligned with that, and that's great. But if you call anybody in the other branches a soldier, they'll probably be taking offense to that. Especially, and I'll tease all the time about Marines. A Marine will be like, I am not a soldier. I am a Marine. I did not join the Marine Corps. I became a Marine. So you're going to hear it in their language. And the same thing with with the Navy, Space Force, and Coast Guard. There is language, there's importance, there's meaning to those things. So during that intake process, be curious and ask, what branch did you serve in? What was your MOS? What was your rank? All stuff we'll probably chat about as we move forward. And then you can even ask them, how do you refer to yourself? I don't know a lot about the Army. Tell me a little bit about that. And that'll help open up and build the rapport that's really needed. But language, very important.
And I think, did we mention Air Force?
Air Force. Oh my goodness, did I skip the Air Force?
It's okay.
Yes, we did skip the Air Force. I apologize for that. That's going to be one of those things. Yes, there are 6 branches. Air Force is definitely included in that. They are our aerial component. Oh, someone's going to be mad about that one.
No, it's all good. We caught it. We caught it. So, can you help us understand, like, how does your experience with the military, like, influence your therapeutic approaches?
Yeah, so treating military members, service members, even their family, it really is, it's a little different than what you're taught traditionally in school, right? There's a little more of a need to be direct with this population. There's not often, embracing this "tell me how you feel" approach with the population. It tends to be a little more guided by the therapist, some psychoed components, education, really solution focused and direct, assist with engagement with this population. Because if once you learn about them, they're all about mission, task, focus, orientation, right? There is a problem, fix said problem, and fix said problem in a reasonable amount of time. So some of the almost free flowing, existential therapeutic techniques that we have, while there is definitely a place for them, may not always land well, especially at the onset when you're learning this new client in your space that has this type of background.
And I want to ask you your thoughts about, just really culture and why it matters. But I'll share one of my first experiences working with the Marines. I was working in an office, and the office that they put me in was family advocacy, which is really where you would go if you were kind of in trouble or if there was like an allegation of domestic violence. It wasn't a place that anyone wanted to be seen kind of walking into. So I had sort of come up with this idea of let's try to bring the services to these drill instructors and see how that works. And for some reason, the commanding officer said, okay, let's do it. So they said, yeah, how about it? I literally got a call after I sort of pitched them. They called me and they said, okay, we're going to do this. We have some time today. The hats will be ready for you at 1400. And I remember like thinking, what's a hat? What's 1400, right? Like I didn't realize, the drill instructors, that's what they called them. So I went back to my desk and I was trying to quickly learn about everything I could. And I walk in the room at what was 1400 and I'm right on time, but I didn't really, but everyone was already there. So I didn't realize that like on time in the military is late, right? And they all stood up when I walked in the room. So I was very confused. I'm like, who are they standing for? And then it hit me that I had these rows, if you can imagine, of these drill instructors, these big men with big hats. And all of a sudden I panicked. And I was like, oh, shoot, like this isn't going to go as well as like I thought it would. And so I said, why don't we all get into a circle? And normally this could take a few minutes and I'm thinking it's going to buy me some time. But it took like a second and we're all in a circle.
And it was a perfect circle too, right?
It was a perfect circle. And I said, all right, why don't we all go around the room and say our name and where we're from? And the first person kind of stood up and said, I'm Staff Sergeant, I think it was Jones. And he said, I'm confused about your question. Where are we from? Where are we from? Yeah. Like where, and, where is our duty station? Where do we grow up? Where, and I say that is my moment where I learned about cultural humility, where I became so keenly aware of what I didn't know. And all of a sudden, everything I knew didn't matter. And I went on a quest to learn from them. So I could be in those conversations. But that's kind of my embarrassing story about how I got started. But I'd love to hear your thoughts about cultural competency and why it matters.
Sure. Oh, I mean, it matters in every population, right? But really, as we're looking to this, to working with the military, culture, we have an idea of the culture as being this really broad kind of thing. And we understand there's nuances and variations throughout. But usually when you go to a region, right, a country, a location, you're able to kind of see some of the similarities. And to your point, military in itself, they're coming together from all sorts of places, right? So if you make the assumption, because this unit is in this state, that this is what you're going to see, or you work with Army, now you're working with Navy, it's going to be the same. It's not. It really isn't. So culture is really the accumulation of traditions and beliefs. And when you enlist in the military, you take all of yours, but you begin to envelop and own the ones of your branch. So having that understanding, again, being willing and open and curious is really what's going to drive you to successfully working with this population, because it's a broad sense of tradition that they don't let a lot of people in. Right? You have to earn your way into the trust by either serving, being a part of the military family, or being willing to be embarrassed a little bit, know what you don't know, and push into that as well. So really, mission accomplishment is a huge component of the military culture as a whole. You have to have that, at least that understanding that it is about mission accomplishment, task completion.
So for people who didn't serve, for therapists who didn't serve, or didn't have the opportunity to work on base like me, what advice would you have for them to kind of demonstrate respect for military values?
Sure. First and foremost, I will tell you, I'll probably repeat myself several times throughout this, seek out cultural competency trainings, right? Seek out the conversation. You have to be, again, willing to learn and embrace what you don't know. And there's a ton of resources out here, obviously, this being one, just as like that teaser, right? To bring you in to say, this is what it is. But cultural competency, attend the training sessions, engage in the training sessions and workshops, active listening with your clients, right? We learn the best from our clients. If you're open with them in the therapeutic alliance, in that setting, you're going to learn more than you will from pretty much anything, because everybody's experience is unique in their service, in their day-to-day. So engage in the active listening for them, right? Learn the terminology to the best of your ability. Now, I'm going to tell you this one, each branch has its own language, its own terminology. So you might learn something on the Army side, and that's not going to land on Space Force, which I'm still learning about that, right? So try to learn some of the terminology, MOS, FOB, in theater, like those type of things. And if you don't know, don't fake it. That has to be the worst thing. If you don't know, put your hand and go, I just have a question. What does MOS mean? And they'll tell you, it's my job. My occupational specialty is my job. There's oftentimes that willingness to share the experience. So be mindful of your, I would say, perspective on trauma and trauma in the military. Engage in that trauma-informed care, but allow it to be a guiding principle and not the primary principle, right? Because trauma is relevant in the military. It is going to be something you're going to see. So be comfortable with that, right? Be comfortable having those conversations, and create the space, right? Create the culturally sensitive space for your service members. Allow it to be comfortable for when they come in, that you don't have, and I'm going to say, nothing overly political, right? Or swaying one way or the other. Really look at your space as you invite them in. Is it an inviting space? And grow with your clientele.
That was very, very well said. We often, which bothers me, but we often associate PTSD with service members or veterans. Can you talk a little bit about, common mental health issues that are prevalent in the military?
Sure. Yeah. So I'm going to lead with PTSD, and then I'm going to tell you never to lead with PTSD. All right. So I'm going to say that. So this is really important here. Are there veterans and military service members who have PTSD, who have developed PTSD along the way? Absolutely. Absolutely. That is the case. But it's not the only thing, right? We want to be creative and open in our clinical assessment, really see the person and look at what they're presenting with. So yes, PTSD is something that you're going to see. But another thing that's been very prevalent, especially in our veterans of late, that mimics or can kind of look like PTSD is a traumatic brain injury, a TBI. So knowing what to look for in a TBI and how it overlaps with PTSD is going to be a critical assessment skill for any and all providers that are working with military and veterans. So those are the two big ones. But let's talk about some of the other stuff. Depression, you're going to see depression. You're going to see anxiety, substance use, marital and family relational challenges, occupational challenges, suicidal ideation. Be comfortable assessing risk. Those are going to be things that you're going to see in your client population, whether they're veterans or not, right? I always want to say, let's be comfortable there as we treat other populations as well. But when somebody comes in, be curious about that. I'm going to say curious over and over again. Be curious about that person and their experiences, because they may be coming into you. And you know what? It actually isn't military related at all, what they're seeking supports for. Or it is, but it's not a deployment combat experience. It's not a deployment trauma. And the other piece that I would say always be comfortable assessing is MST, military sexual trauma. Ask both your male and female clients about sexual trauma, because that is something that we continue to see throughout our military. There's been a number of initiatives to combat that within the branches and within the military as a whole. But those are going to be the things that you'll potentially see throughout. So that's, that's kind of, the big piece here is being able to see them for who they are as a person, not just as a service member for their service. Does that make sense?
Yes. And so well said. And I think that almost everything you said to assess for are things that, also hit the common, everyday people outside of the military. But it is funny that you also have that similar reaction to PTSD, because also civilians can have PTSD.
Absolutely.
Are there, when you think about these different kind of, screening people and asking those questions and to be comfortable with them, are there assessments or screeners that you use? Is there anything that you would recommend?
Yeah, PCL5 for trauma. That's a great one. Have that. And again, I think that's a great thing to have in your general practice. The PHQ and the GAD. So we're looking for depression, anxiety, and trauma. Those are ones that I lean on pretty regularly when I am, I'm doing an intake for a new individual.
How are you feeling about sort of the evidence-based interventions in this field? For now, another thing I often I always am very careful to say, most people I think don't understand that when somebody is a service member, they are actively serving or in the reserves, but then when they leave the service, they become a veteran. And I think sometimes people get very confused about the difference between active duty and veterans. So I think I'm really asking this question more out of curiosity, because as we know about evidence-based interventions, they change as time goes on. How are you feeling about that? Are you feeling like they're getting better?
So I think we have some solid interventions and modalities that we can utilize. It is all about the clinician's comfort with them. And we have to be interested in the research behind it. I would never say push into any of them without without moving towards your own individual professional development and education around them, because we have things that have been used among the veteran population, such as prolonged exposure, cognitive processing therapy, EMDR. Like, those are all things that have shown a level of success with this population. Then we have mindfulness based interventions, which I think is something we can sprinkle in throughout, group therapy and couples therapy. So those are the evidence-based things that we're, really looking at for this population. But as an individual practitioner, for myself, I'm trained in both prolonged exposure and cognitive processing therapy. I enjoy cognitive processing therapy better. It aligns with me better. So then my clients are getting kind of a better version of me in the space. And that's something that works for me, where I know a number of clinicians. I'm also EMDR trained. I know a number of individuals that, EMDR aligned with them. So their clients are seeing great outcomes with that modality because that provider's aligned with it, and that translates to the clients. So I think we have a lot out there. Those ones I rattled off are absolutely going to be ones that as you do your research and look into this and try to say, hey, I might want to do this. You're going to find working with veterans, working with military, and with first responders that has shown a level of success. But if you're a therapist that isn't really comfortable with, EMDR, you might be comfortable with CPT. If not CPT, maybe PE as you work with this population. And all else fails, cognitive behavioral therapy is the foundation to all of this. Some good old-fashioned CBT is absolutely going to be something that's going to support and promote growth with your clientele, as long as it's something that aligns with that individual, provider's style and stance and how they engage in treatment. So I read about these things. I've read about all those things. I've engaged in trainings myself. And then I said, this one works for me. So that's an encouragement for these, providers. Read
That's
through
great.
it. Yeah. Does that make sense? I mean,
absolutely. And I'm going to give a shameless plug. And obviously, Psych Hub does a lot of that great training, but Psych Armor also has much more in-depth CPT and PE training, and it's free of no cost. So I think that taking that extra step to learn and figure out what is the best sort of what do you like the best, or that resonates the best with you, and kind of going from there. So can you provide an example of a time when you had to adapt like your therapeutic approach to align with cultural competency, where maybe if it was somebody who wasn't in the military, it might have been different?
Yeah, so I think one of the things you'll find with anybody that comes through is you have to be adaptable and on your toes. I feel like I have to always adjust. We have to adjust fire with each client that kind of comes in. The biggest piece for me, I would think, is I was enlisted, and I have spent a lot of time with enlisted individuals, right, versus officers. So that in and of itself is, a culture within a culture, and different roles and responsibilities and all, that's we could spend all day on that too. Well, noticing when I first started working with some officers and because now I'm in this whole different world, and really have to start to learn and understand, wow, that is different. It is a different kind of view and stance and cultural subculture within the military. So you're always going to have to adapt. You're always going to have to be on your toes. It's like I'd say a constant shuffle and game with this population, because they like to try to rock you a little bit, which I think is great. You got to kind of enjoy that piece of it. But yeah, so kind of moving into understanding it from that leadership type of perspective on the officer side, and then the big difference between active duty military, reserve, or veterans, where they are, quote unquote, in their lifespan, life cycle of the military. So learning how to reintegrate at home and let go of some of those traditions or the culture that isn't helping in the transition at home. So it's a lot of adaptability and willingness to shift and be creative in your thought process and your techniques.
Have you seen any common obstacles that therapists who work with this population would run into, or you could maybe give them a tip to expect to run into? You gave us some ideas, but any
I
more?
alluded to some of those. Trust is huge in this population. It is not given; it is earned. So when they come in, and I say that in a, that broad generalization type of sense, when you're meeting with that service member, that veteran, that military member, what you're going to find is they're not going to give trust over willingly. You have to earn that. You have to earn that in your genuine engagement, in your knowledge, in your curiosity. So you might find, there's going to be a little bit at times of shock value. be comfortable with swearing. The fact that I've made it this far without dropping an F-bomb is pretty impressive. Like I'm going to give myself a pat on the back. Because, swearing, and I'm not saying allow them to abuse you. No client should be swearing at you right in the face, but there might be some interesting and colorful language that you'll hear. If you can't kind of work within that, even as a gentle, redirect at times, it's all about placement. You can lose that connection. Well, if you can't handle me swearing, are you going to really be able to handle what happened on deployment? Or am I going to be able to trust you with my MST? Or am I going to trust you with my family issues? So there will be testing a lot of the times. There may be safety behaviors that somebody, a therapist, trauma therapist might want to kind of push into sooner rather than later. Those safety behaviors, such as clearing a room. If you've never seen somebody clear a room, it's an interesting thing to see for the first time. They come in, they're checking all the corners. Placement in the room and where they sit and how they listen and where they attend. Those are all things that if we look at it without the context of the client, we can get into some really heavy diagnostic things there, right? We can misdiagnose because of their behavior without, if we don't have that understanding of what we might be seeing. So you'll probably bump into this, and then you'll see one veteran that won't have any of these things that I've discussed here, because that's kind of the nature of it. You have to be adaptable, you have to be flexible, and they will test you. That's pretty much a guarantee.
I think that was great. I know when I first started working with them, I also had a private practice in San Diego, so sometimes I would see them there just so that they could be off base. And one of the first ones I was behind a train track. And when the train went by, it kind of rumbles. And he immediately got up and jumped behind the couch, like pushed the couch up and got behind the couch. And, I've had some really, but you get more, but I think what you said earlier, which I think is key too, you have to get comfortable with it. Mm-hmm. And the more comfortable you get with it, the more you understand where it's come from. And I also thought one of the things you said that I think is so key is that curiosity, because if we're curious about our clients, they can feel it and they feel more comfortable. But if it's just very, a check in the box of getting through the session, they're going to feel that too. And that's going to affect that trust that you said. So I think those were great. Let's talk a little bit about military kids. Tell us a little bit about that. Any things to think about or to consider?
Yeah, so kids and families, these are, I'll say it now, someone can challenge it if they want, but I believe it. They are the most resilient group of people that there are out there. I'm going to stand by that, because these individuals, a lot of the times they didn't, a spouse, there's rarely that you're going to have a two-service household, right? Mom and dad both serving. You have those, right? But more often than not is one individual serving and then another individual married into that. Sometimes they have experience with the military, sometimes they don't. And then we have these kids, right? So it is a very real thing that a family goes from pick a state to another state, pick a state to another country, right? So you have these children and you have these spouses, just a family unit as a whole that is so resilient and adaptable, because they're having to adjust from one city to state to country, and they learn and embrace a good portion of the traditions and the cultures, because there is an expectation that it's not just the service member that is supposed to be poised and professional and engaged in proper manners, right? That translates to the family as well. So if your kid's getting in trouble, right, that can go all the way back and impact through the chain of command. So military children, they are very unique. They will shift and make friends like that. There's an adaptability again in the military unit, the family unit as a whole, because they have to adapt to survive. This is what we do. This is the connection to the military. This is a connection to the unit. This is what we do. There's such honor and duty that you see. And now that doesn't mean that these kids, aren't, experiencing challenges throughout life, changes of school, changes of friends, developmental milestones and transition points. So there are some challenges with the military family as well. But I always want to just remind people of how resilient they actually are. So as you're treating a service member, a veteran, active duty, any of the names that they might go under, ask about the family. Ask about the family as a support unit. Ask about the individuals within the family, because where they go, right, they go together, the family unit transitions. So wherever they are, they go, there they are. And incorporating them into treatment when appropriate is highly encouraged.
So well said, Sheena. I got the privilege of a couple different times working in a DoDEA school and working with active duty kids, actually in other countries, one in Germany and one in Italy. And it is really fascinating. And I agree with you. So much resiliency. And what's really cool about it is that oftentimes, if they're in a DoDEA school, right, a Department of Defense school, they're very used to people coming and going. And so they're also very inviting. And there isn't this sense of, oh, you are the new kid, unless they're in, community schools. But one of my favorite things about the military is how these bases are so, inclusive, and they have schools on them and preschools on them and all of that. But I think that's also just an important piece to understand about the culture. Let's move over a little bit to kind of collaborating.
Sure.
Can you describe how to collaborate with the military support systems, such as the chaplains or the family service, programs? Obviously, collaboration looks different if they're active duty or if they're a veteran, whether you're collaborating with the VA or whatnot. But I'd love to hear about that.
Yeah, so very simply, do it, and knowing that's a complex thing, right? So as simply as I state, make sure you are doing those things, that you are finding out what's in your state. Do you have reserve posts, active duty posts? What is in your area for veteran support organizations, as well as just the military installation? If you're in, a state that doesn't have an active duty component, you'll probably have a reserve component somewhere. So being involved in military events and local things is a great way to start. But I love the chaplain. That chaplain is the person, man. If you could find one person, it is the chaplain. Lock in with them. They are everything. They're an everything person to it on a base, right? So they will be the spiritual advisor. They will be the mental health counselor. They will be the confidant. They tend to have that role. So when at all possible, do that. But, establishing communication channels, reaching out to the VA, the VSOs, learning who they are, who are the players. One of the things with the VA, and I say, is as an individual practitioner, you can contract with the VA in the community care network. So that means you can treat and be reimbursed for working with veterans. It's a nice way to expose yourself to VA, again, VA culture and everything else.
How do you involve and work with military communities, including command structures, in the therapeutic process while still respecting confidentiality?
Yeah, so we go back to that comment of trust, right? I said that the trust isn't given as earned. So there's times when, depending on the type of provider you are, whether, you're in a system or individual practitioner, there needs to be some kind of awareness of the chain of command in the unit that your individual is coming from or serving in. So what I have found in my area is a lot of the command is actually very, very invested in the health and wellness of their soldiers. Some branches are more friendly than others. I'm just going to kind of put that out there. So when you're working with that service member, remember that veteran, you are working with that person. You have to determine what is in their best interest. Sometimes it absolutely is working and getting in kind of their, again, the chaplain, or in the National Guard is the director of psychological health that is overseeing a lot of the behavioral health. There may be behavioral health officer. Those are all individuals that can be supports, but you have to start with trust. You have to start with your service member, your veteran, and get their consent, right? It's a little different as a private practitioner or somebody in a healthcare organization that might have a contract or something along the lines with the unit itself. So explain what the diagnosis is to your client, explain confidentiality, the limits of confidentiality, understand who those contacts are. Is it a DPH? Is it a chaplain? Is it a different type of behavioral health officer? Get the understanding of the climate of the unit from your client, and then make that decision to pursue and move forward. Now, there are going to be times that limit to confidentiality is a very real thing. I need everybody to know your service member, if they're reserve, active duty, even a veteran, right? They're probably going to have access to firearms. They're probably going to have firearms in their home. They're probably going to have to go to the range and qualify at least annually. So if there's suicidal ideation, if there's any concern of safety, we do need to make sure that we are getting to the appropriate person in their unit to ensure that, they may not go to the range that weekend, right? So who is it? But who is that person? Who's the contact? Who's the support? You can work through your client to be able to gather that information. And more now than I'd say historically, units and the military becoming more aware of mental health considerations, PTSD, suicide risk, substance use, and not always is it an automatic penalty or discharge. It has been historically. So you might have somebody who's like, I'm not telling you anything. See, I almost swore there. It would have to be bleeped out. I'm not telling you anything because I don't want to lose my security clearance. I don't want to lose access to my weapons, so on and so forth. You'll hear those things, and us as therapists might go, what do you mean by that? That doesn't happen. That doesn't happen. It might, it may, it has. Units are getting better now, but we need to understand the risks of that. Some of these diagnoses are potentially career ending, and that's a tough thing. So the more collaboration and engagement we can have with key stakeholders in the unit, if that's a safe kind of option for our client, then we should do it. I have my organization and myself have a great relationship with our local director of psychological health. They are so invested in health and wellness and keeping their soldiers happy, healthy, and progressive that it's been a really positive experience in that collaboration.
It's there's been this expression, which I love, that the military breaks down doors for the rest of the world, or the rest of the country, really, right? Mm-hmm. Which is really, when you kind of unpack it, means that they oftentimes have to sort of set the example that everybody else follows. And talking about PTSD and some of this stuff is an example of how they made that terminology acceptable. They ended up owning some of the, stigma and stereotypes that go with it, which aren't really fair. But I saw just this morning that I think a 2-star general just came out with a book about his experience of being bipolar. And I think he was on NPR yesterday, and I can't remember what his name is, but I'm going to have to pull it up. But what I thought was really interesting was that these people are using their platform to say it's okay. Like, this is what happened to me. And I give the military so much, or the military community so much respect for that, because when they do that, it really does kind of make it okay for everybody else. Absolutely. I know we've talked a lot about military. Can we talk a little bit about first responders?
Oh, I love first responders.
What are the differences there between military and first responders? Are there any?
Yes, there are. And this is one, like, going back to yes and no, because a good portion of individuals that have served our country in the military come back and they become first responders. There's a lot of that overlap. Then there's absolutely some people that just, become, not just, but they become police officers, firefighters, EMS, that have never served their country in that fashion, right? So we can see both, but the first responder realm is a paramilitary career. So a lot of the characteristics and characteristics and traits that you're going to see in our military members and our veterans, you will see in our first responders. Now, big differences between really between our veterans and first responders is there is a difference when even active duty or reserve get deployed, right? They're home in the sense of reservists are home and in their community, and active duties on their ecosystem of the base, right? And then they get deployed and they go away for X amount of time, and then they come back, right? First responders, they put on that uniform every day and they go out into the street every day, and they're interacting with trauma on a daily cumulative basis, where, not minimizing, you could have daily trauma while you're overseas and deployed, but then you come home and that day to day ends, where first responder is constant. They also, I always say that first responders have a real there's real engagement with the political realm and arena, right? And how they're used. So there's different media and face time for a first responder, right? A police officer can go from a hero to an enemy, as we saw in COVID, pretty quickly overnight. And it really created this atmosphere of confusion around, can we trust, can we not? Whereas media does the same to veterans and service members, but right now we're seeing them in a more favorable light versus maybe Vietnam when they were returning home. So we have some overlap. We definitely see some things that are similar in characteristics, personality characteristics, the person that goes in, as well as the residual impact of trauma with our first responders, right? So they're seeing day-to-day cumulative trauma. There's that stigma, you have that you are supposed to behave in this way. You can't have mental health issues, right? And we know that that's not how it works. That's not how any of this works. But the same thing with their family, resilient family as well. There's a community for their family. But there's differences between the occupations, law enforcement to firefighters to EMS. We have those cultural nuances there as well. So there's a good amount of overlap between the two, mental health, traumatic response, personality characteristics, and same thing with officers, and same thing with, the first responders and military first responders. Don't lead with PTSD. Do not lead with PTSD. God, if there's one thing you can take away from that, it would be this, because they're also human, just like our military and veterans are human. So they're going to have other type of experiences, anxiety, depression, substance use, family, grief, and loss. Like you're going to see those things. So it's a great, I love both populations. So, I love
that was a great description. I'm going to throw one more in there that I think sometimes can be confusing to people of where they fit, which is the National Guard. Can you help us understand a little bit about that?
Yeah. So our National Guard is, we have them all over the place. You'll see them in uniform walking around. They actually respond. They report up to the governor, right? So they respond in the state. So much like I said with Coast Guards, when I forgot the Air Force, like I said with the Coast Guard is Homeland Security, not DOD, until they become activated in wartime. Then they shift over to the DOD. So National Guard is under the governor, within the state until they're activated. So they can be deployed. They are trained as the rest of our military, but they're usually, a good portion of them are reservists. And so they're 1 weekend a month, 2 weeks out of the year. We do have some active duty guardsmen who are manning the installations. They too have a behavioral health component, which is great. And we've been able to work with them wonderfully. They also respond and do a lot of humanitarian activities, both, stateside and overseas. So it's interesting, some of the differences there, but they're very much home based. They're very much still within their individual, almost like civilian communities.
I think what's important to also note is that sometimes your reservists and your National Guardsmen, you see them in everyday attire, and sometimes they're working in companies and you don't realize them, and they sometimes feel like they don't fit in into either of these
Right.
cultures because they kind of have one leg in one and one in the other.
Right.
Have you seen any of that in your experience?
Oh yeah, tons. Right. Again, that's one of those things. Yeah, absolutely. Because, I see this, a good example of that, both when your people are adjusting to working, but is in school. Because a lot of the times when we see a returning service member or, a guardsman who's been deployed comes back and they go to school, there's a different type of perspective and interaction in school. Their experience is different than their peer. That 19-year-old kid sitting next to this 20-year-old kid, one was deployed, one just came out of mom's, I'm just going to say basement. I'm going to say basement. Mom's basement. I'm going to get flack for some of that stuff, but I think it's okay. And there's a different world experience. Same thing in professional, in the professional corporate world, because in the military, whether it's, whether it's guards, reserve, whatnot, what you find is everybody knows their role, rank and file. You know what your job is, your responsibility is, who to respond to. And that's not always clear in the civilian sector. You kind of walk in and the rules are different. So there's a little bit of like, where do I sit? Where do I belong? How do I adapt? Some people adapt fine. Some people struggle a little bit. Those things are very, very possible. And I think it's great because we also have attention to that as well. And how do we reintegrate into these places? Where do I kind of fit in? But there are differences, and a lot of I do see a lot that come back that's like, this dirty civilian. They did X, Y, and Z. That's not how it's supposed to be done. And it's like, well, let's talk about civilian world versus military world, because there are some gap areas, right? There's less overlap in some instances.
I so appreciate this because to you guys out there listening, I'm just throwing her all kinds of questions that were not pre-planned, and she's just doing great with them. Can you help our listeners understand actually what a reservist is? Because I think we talked about that. You said it from the beginning, but if you're not from this culture, it can be confusing. So what would be the difference of somebody? Let's actually go one step even backwards. What would be the difference of someone going in enlisted, someone going in officer, or someone going in reserve?
Sure. Okay. So when you're enlisted, so there's good. There's a whole bunch of this. I don't have any of my little PowerPoint to go along with this. But enlisted is generally, just in terms of requirements, is usually a high school diploma. Now, there has been some variation along the way where some branches has shifted from GED to high school diploma. Sometimes you're going to see that with a shift in standards depending on recruiting numbers. But enlisted, while they could have a college degree, there's to become enlisted, you would, need a high school diploma. And those are very much the, technical jobs. They are the not entry level positions, because as you move up through the ranks, you grow in experience, responsibility, and you take on more leadership role. Where an officer, more often than not, education wise, there's a requirement for a college degree. As a straight officer, then you have warrant officers, right? Now we're getting into nuancy things. But even a baseline of at least a bachelor's degree, and then you're more in a leadership position. I almost think of officers as corporate, right? They're the corporate strategic strategy and what was the word? I lost the word. Anyway, so they're more corporate in strategy, right? Big picture and how to make the whole operation run. Where enlisted is that day-to-day activities to keep everything moving, right? All of it is geared towards mission accomplishment, but you're going to see some variations in responsibility, role, and just how they're going to present and who's going to report up to them. So with each rank, you have a few more people reporting into you, but as an officer, your responsibility is over the battalion, the company, and so on and so forth. When we talk about reservists, so reservists is kind of that classic, 1 week in a month, 2 weeks out of the year. Those individuals will don their uniform during that frequency, and they will go out and do training activities. They're usually at a reserve base or a reserve component, which is much closer in their community. right? It's going to be in their community or within a certain distance from their home or their state. Where active duty goes to an active duty post, they're full-time military. So that uniform is on them every single day, where the reservist is at once a month. Now, don't be confused. Reservists and National Guard deploy a ton. Reservists deploy probably more than our active duty component, because our active duty component is, really running the ecosystem of the bases in that support element. So you're going to see active duty will deploy, but reservists will deploy as much. But these are the individuals that'll, they'll disappear for a weekend and they'll come back on a Monday or a Tuesday, and you won't know that they were at the range, they were swimming, they were climbing mountains, they were doing all sorts of fun, dirty stuff. So that's a little bit of the, the differences in that you see. I mean, there's so many layers to this when we start looking enlisted officer, warrant officer, gunnery sergeant to a private. It's all about your rank and file.
I really appreciate you going into that, because I think that the basics are important to know, and the details can go back into that curiosity where we can ask those kinds of questions. But I also think you did such a good job explaining it. I always just think it's fascinating too that you can move up those ranks in these different roles. So, enlisted, as you move up to a sergeant major, you can kind of, if you choose to stay in longer, each one of them. And then the officers do have these partners that are on the enlisted side, and they work side by side. When I was at MCRD, I did we used to joke and call it marriage counseling, but we would take the sergeant major and the, when I was working with the companies, the company commanders, and then we would have the battalion sergeant major with the CO. So I and just kind of go through what's what. And, but so it is great because they both need each other. But it's important to just kind of know the basics. What does enlisted mean? What does an officer mean? What does reserves mean? Absolutely. And, you can be a reserve enlisted. I mean, you could be a reserve officer, but just understanding all of that. This was so great. Just in recap, today we discussed culturally responsive care for veterans and active duty military and strategies that clinicians can use in therapy. So what would be the number one thing that you would want therapists to take away from this discussion?
Oh, I'm going to be a broken record. Look beyond PTSD. Look beyond PTSD, but really be open, be willing, and be curious, and you can be successful with this in any other population.
That is great. Thank you so much, Sheena. Where can our listeners find out more information about you and the work at Forge?
Oh my goodness. Yeah. Jump on our website. We have a nice, pretty website, forgehealth.com. I have a LinkedIn somewhere. Would love to chat with people. Come and find me. But those are two places that you can definitely start and outreach. And I'm here for consultation and supervision as well. So.
Amazing. Thank you so much for taking the time out of your busy schedule to talk with us today.
Thank you.
Thanks so much for listening to Therapy Cafe, the future of mental health. For more information and resources regarding today's topic, please take a look at the episode show notes. If you'd like to obtain continuing education as a psychologist, counselor, social worker, or therapist, you can purchase a 1-year subscription to PsychUp's learning platform. Once you're signed up, you'll have access to earn CEs for this and every Therapy Cafe episode. Plus, you'll have access to our existing library of over 100 evidence-based practice continuing education courses created by expert clinicians. Go to psychhub.com/sign up for more information.